Alright, we're going to talk about some basic anatomy to understand the parts of the spine and how they can be injured. The spine is made up of 33 bones called vertebra. You can see if you follow the mouse. They extend from the hip to the base of the skull. The vertebra have two functional areas: the vertebral body, which is responsible for weight bearing, and the facet joint, which is responsible for movement. So the body is the bulk here of the vertebra, and then the facets are the pointy ends on the side here. Spinal nerves come off of the spinal cord on both sides between each vertebrae. Between each vertebrae is a gel-filled sac, which provides shock absorption, support, and movement. So you can see these holes, they're called foramen. That's where the spinal nerves, along with blood vessels, come off the spinal cord. And the discs are in between each vertebrae. Muscles and ligaments keep all the structures in place and allow small movements, but their main purpose is to support and stabilize the spine. You can see over here, this is a blown up view of some musculature in the low back. And these muscles here are supporting each segment of the spine. They're probably not any bigger than your pinky finger. They're made to support each level, and they're not made for heavy lifting. There are two layers of muscles in the back. A deep group close to the spine attaches from vertebra to vertebra, and a superficial group which attaches above the deep group and from the vertebrae to the ribs. Like I said, the muscles are small, in some cases just a few inches long, and are designed specifically to keep us upright and to protect the spinal column. In contrast, the muscles of the legs and glutes are the largest in the body and are very strong, making them way more effective for bending and lifting. These are the muscles we need to avoid stressing in our backs, are these tiny ones. So just for some orientation also, this would be the front of a person, and this would be the back of the person. Also talk about is good posture, and that's essential for having a healthy back. The spine is divided into three parts. The neck and the lower back regions have a gentle inward curve, and the middle back has a slightly rounded curve. So you can see the three curves here. One there, and then one down here. These regions create an S shape called a neutral or normal spine position. Proper body alignment starts with the feet directly below the hips, with your weight evenly balanced, the knees soft, the chest lifted up with lightly contracted abs. Shoulders should be back and relaxed with the head straight. Assessing and correcting your posture throughout the day is a great way to retrain and reinforce good alignment for strong, balanced spine. We should be trying to keep this neutral spine through all of our movements, including bending down and picking something up from the floor or assisting someone in a transfer. It's really important that we keep our spine as close to neutral as possible. Good posture while sitting is even more important because the very act of sitting loses that natural curve in the lower back, causing a rounding in the spine. Over time, this extra pressure on the lower back can lead to disc problems, pain in your shoulders, back, or even headaches. Ideally, we should sit with a neutral back with all three curves aligned, keeping the weight evenly divided between the legs and the hips with feet flat. Does anyone really sit like that? Probably not. Are there ways to sit that aren't harmful to the spine? Yes, you can sit on the floor, squat, or sit on a stability ball, but that's not very practical outside of your home or at work. My suggestion is to sit actively, move around in your seat, reposition yourself as often as you need to, maybe practice sitting with a neutral back for a few minutes before you return to a relaxed position. Just keep moving, and whenever you start to feel stiff, stand up, stretch, or take a short walk. This keeps your hamstrings and lower back from tightening up and pulling your spine out of alignment. Ideally, you should do this about every half an hour. Our bodies were designed to stand and move, not to sit, especially in chairs, so try to keep active. So this picture here is just blown up a view of the lower spine. You can see that there's a normal disc, a degenerative disc. Typically this happens with aging, the normal aging process. Our discs lose fluid and lose shock absorption. And that's pretty normal. But as you go down, you can see a bulging disc and a herniated disc. This is when we start to have issues. Bulging discs can be reversed through better body mechanics, things like physical therapy, certain types of exercises. Those can be reversed over time. Once there's a herniated disc, it's pretty difficult to reverse. Sometimes the body reabsorbs this fluid over time, but you can see that this fluid would be pressing on nerves and blood vessels that are branching off from the spinal cord. A good example or a good analogy would be a jelly donut. It has a harder outside layer with a softer jelly inside. So if you squeeze the front of a jelly donut, it's going to push that jelly to the back, and vice versa. Same sort of thing happens with a disc. If you're bending improperly and you're pinching down the front of this disc over and over and over again, it can then push this fluid towards the back, and then eventually it'll rupture, and this fluid can escape and cause issues affecting your legs and your arms, depending on what level of the spine it's happening at. However, back pain can be the result of many different things. Pain can be triggered by a combination of overuse, muscle strain, or injuries to the ligaments and discs that support the spine. Back pain happens to just about everyone at some point in their lives, but there are ways to protect yourself from developing a serious back issue. Using good posture, like we talked about, and body mechanics throughout the day, and strengthening your core will help maintain balance in your spine and keep your back strong and flexible. Research has shown that when standing and bending forward at the waist improperly, with rounding your back, just picking up a pen, they found that there is 500 pounds of compression force at the point of the greatest bend in your back. That force is trying to squish your discs, like I just explained, out of place, and the only thing holding the discs in place are those little tiny muscles and ligaments that we talked about previously. Picking up a 50-pound object instead of a pen adds an additional 300 pounds of compression force. So imagine 800 pounds of compression force really focused on a small part of your back. And that's happening every time you bend over improperly. That's happening without carrying a heavy load in your hands. So always remember to use your legs, your core, and to keep the spine as neutral as possible whenever you're bending or lifting something up from a lower surface.
Okay, so now that we've talked a little bit about the anatomy of the spine and the risks of injury, we want to talk about body mechanics and the proper position for you to use whenever you're lifting and moving anything. It could be a box, it could be laundry, it could be assisting someone with a transfer. So whenever you are doing lifting of any kind, you want to make sure you have a wide, stable base of support. So your feet need to be far apart. They can either be like this, or you can stagger one foot in front of the other. This is so you have stability, so you're not going to lose your balance, but it's also so you can shift your body weight and use your body rather than your arms or twisting at your back, which puts you at more risk for injury. So you want your feet wide. And you also want to think about the footwear that you're wearing while you do this, because if you're wearing high heels, open-toed shoes, you're less able to do this safely. So you also want to think about that natural curve in your back that we talked about. There's the curve in your low back. you want to make sure you're not rounding. So if you need to bend down to get anything, you should be bending at your hips and at your knees. So you're going to get in kind of like a squat position. This is also engaging the biggest, strongest muscle of your body to help you to do the work. While you're doing this, you also want to think about engaging your core muscles that help support your spine and helps decrease the risk of injury. So you also want to think about whenever you're moving something, it could be an object or assisting a person, you never want to keep your feet planted and turn because it puts a lot of stress on your spine. You always want your nose and your toes to be pointing in the same direction. So whenever you're lifting anything, you're going to pick it up and then you're going to move your feet to your destination. You also want to keep whatever you're lifting close to you. So if I'm holding an object here, you're keeping that good curve in your spine, you're engaging your core. If you hold something way out here, gravity makes it feel like it weighs even more, and you're more likely to round your spine, which puts undue stress on all of those important structures that we talked about. So putting that all together, I'm going to show you guys just picking up this box. So I'm going to get close to it, my feet are wide, I'm not going around my back, I'm going to bend at my hips and my knees, engage my legs to do the work, pick it up, keep it close, and then I would move my feet to set it down at its destination.